Dear audience, Assalamu alaikum. I am Professor Shamsudjaman, Professor of Pathology. I welcome all in today's lecture on pathology. This is my 15th lecture on pathology. Today's topic is inflammation. Today's topic is inflammation, and this is the first day of topic inflammation. First day of topic inflammation. Now come to first, what is inflammation? What is inflammation? Inflammation is reaction of vascularized living tissue to local injurious agent. So reaction of vascularized living tissue to local injurious agent provided the injury does not destroy the tissue, is called inflammation. So reaction of vascularized living tissue to local injurious agent provided the injury does not destroy the tissue is called inflammation. I told you reaction of vascularized living tissue. You know, this is my vascularized living tissue cheek. If I can make an scratch with the help of a pin in my cheek, this vascularized living tissue will react. And how can you know the reaction? There will be swelling, it is a reaction. There will be redness, it is reaction. There will be oozing, it is a reaction of the vascularized living tissue. Again, if we disturb a vascularized living animal, the animal will react. If the injurious agent destroy or kill the animal will not react. So, if the injurious agent destroy the tissue will not react to injurious agent. So reaction of vascularized living tissue to local injurious agent provided the injury does not destroy the tissue. Again, if we disturb the dead animal will not react. So this is the reaction of vascularized living tissue. During the reaction of vascular living tissue, what are the component parts of tissue is involved? Component part of tissue involved in reaction. What are those? One is muscular tissue, connective tissue, nerve tissue. Now come to what is infection. This is inflammation. Now come to what is infection. Infection inflammation caused by microorganism like bacteria, virus, fungus, etc. is called infection. So when inflammation is caused by microorganism is called infection. So we can say All infection is inflammation, but all inflammation is not infection. Now come to types of inflammation. One is acute inflammation and another is chronic inflammation. One is acute inflammation and another is chronic inflammation. Chronic inflammation. Now come to what are the differences between acute inflammation and chronic inflammation. Differences between acute and chronic inflammations. Between acute and chronic inflammation. Acute inflammation and chronic inflammation. Number one, onset of reaction. Onset of reaction. In case of acute inflammation, onset is sudden onset. But in case of chronic inflammation, the onset is gradual. That is insidious onset. Number two, duration of reaction. Duration of reaction. In case of acute inflammation, the duration is shorter duration than chronic, shorter duration, like a few minutes to few hours. But chronic inflammation duration, prolonged duration. How much prolonged? It may be a few days to few weeks, to few months, to few years also. As for example, tuberculosis. It is a chronic glomerular inflammation. The duration is few months or few years. Number three, nature of inflammation. Nature of inflammation. The nature of inflammation, acute, is exudative in nature. Exudative nature. In case of acute inflammation, at the site of inflammation, there is formation of exudate. So it is called exudative nature. What is exudate? It will be discussed later on. And the chronic inflammation is proliferative in nature. Proliferative in nature. Number four, inflammatory cells. Inflammatory cells. Dear audience, I have told you inflammation, reaction of vascular living tissue. Suppose this is a tissue and this is the blood vessel within the tissue, like this, and this is the form elements including the WBC. When the WBC present within the blood vessel, these are WBC, and in case of inflammation, the WBC comes out of the blood vessel in the tissue. When the WBC comes out of blood vessel in the tissue, then the WBC is called inflammatory cells. Now come to what are the inflammatory cells present in acute inflammation in the tissue. One is neutrophil, another is eosinophil, and another is basophil. These are the acute inflammatory cells. You can get it outside the blood vessel in the tissue at the site of acute inflammation. And chronic inflammatory cells are macrophage, lymphocyte, epithelioid cell, plasma cell, giant cell. So these are the chronic inflammatory cells, and this is the differences between acute and chronic inflammation. Dear audience, now come to, I have told you the chronic inflammation is proliferative in nature. At the site of chronic inflammation, what things are proliferated? Proliferations in chronic inflammation. In chronic inflammation, what things are proliferated at the site of chronic inflammation? Number one, fibroblast and blood vessels. We are talking about acute inflammation now and chronic inflammation differences. And I have told you at the site of chronic inflammation there is proliferation of fibroblast and blood vessels. Now come to proliferation of blood vessel. What is the term of proliferation of blood vessel? What is the term of proliferation of blood vessel? There are two terms. One is vasculogenesis. Vasculogenesis. What do you mean about vasculogenesis? The proliferation of blood vessels in intrauterine life is called vasculogenesis. What it means? Proliferation of blood vessels. Proliferation of blood vessels in intrauterine life. In intrauterine life is called vasculogenesis. Another term is angiogenesis. Angiogenesis or neovascularization. Neovascularization or neovascularization. What do you mean about neovascularization or angiogenesis? It means proliferation of blood vessels or formation of blood vessels. Proliferation or formation of blood vessels after birth is called angiogenesis. Dear audience, what are the situations where after birth there is new blood vessel formation? That is, what are the situations of neovascularization? Now come to situations. Situations of neovascularization. Situation of neovascularization. What are the situations? Number one, chronic inflammation. Chronic inflammation, I have told you the chronic inflammation is proliferative nature, so there is proliferation of blood vessels. Again, in healing and repair. Healing and repair. Dear audience, you know, during healing and repair there is formation of granulation tissue, and one of the composite part of granulation tissue is new blood vessel formation. Again, neoplasm. Cancer, neoplasm, benign or malignant tumor. If anybody suffers from benign or malignant neoplasm, within the neoplasm there is proliferation of blood vessels or formation of new blood vessels. So these are situations of neovascularization. Dear audience, now come to acute inflammation in details. Acute inflammation in details. Now come to acute inflammation in details. So what are the criteria of acute inflammation? It is suddenly onset, short duration, exudative in nature. Now come to some signs of acute inflammation. Whatever may be the site of acute inflammation, there are 5 signs, and 5 signs we can get at the site of acute inflammation. These are called cardinal signs of acute inflammation. Cardinal signs of acute inflammation. So whatever may be the site of acute inflammation, we will get 5 signs that are called cardinal signs. Number 1, rubor. It means redness. Whatever may be the site of acute inflammation, at the site of acute inflammation, the tissue or the organ become red. Then calor means heat. At the site of acute inflammation, the tissue will be hot, warm. Dolor, it means pain. Tumor, it means swelling. And functionalisa, it means loss of function or restricted function. Loss of function or restricted function. So these 5 signs are mandatory for acute inflammation. Whatever may be the site of acute inflammation, we will get these 5 cardinal signs. Without these 5 cardinal signs, we cannot say it is acute inflammation. So these 5 signs we can say it is the heart of acute inflammation. As we can say it is heart of acute inflammation, these are called cardinal signs. These are called cardinal signs. We can cite an example, acute conjunctivitis. Acute conjunctivitis is an acute inflammation of conjunctiva. So we can cite an example of acute inflammation, acute conjunctivitis. Acute conjunctivitis. You know, if anybody suffers from acute conjunctivitis, there will be redness of the eye. So this is rubor. And acute conjunctivitis, there is, if you feel the temperature of the affected eye by dorsum of the hand, you will feel warm. So it is calor. And the patient feels pain in the eye, dolor. And there is swelling of the eye. This is tumor. And patient cannot see properly, or there is difficulty in vision. This is loss of function or functionalisa or restricted function. Dear audience, whatever may be the site of acute inflammation, we will get 5 cardinal signs. Now come to how the 5 cardinal signs are induced. How the cardinal signs are induced. How the cardinal signs are induced at the site of acute inflammation. These cardinal signs are induced by changes in vascular system, or that is, we can say vascular phenomenon is associated with the induction of cardinal signs. Vascular phenomenon. Vascular phenomenon is associated with the induction of cardinal signs. The phenomenon includes, number 1, changes in vascular flow and caliber. Changes in vascular flow and caliber. Number 2, changes in vascular permeability. Changes in vascular permeability. And the third one, cellular events or leukocytic events. cellular events or leukocytic events. So, changes in vascular flow and caliber, changes in vascular permeability, and change in cellular events or leukocytic events, all are the vascular phenomenon associated with the induction of 5 cardinal signs at the site of acute inflammation. Dear audience, now come to first changes in vascular flow and caliber. Changes in vascular flow and caliber. Changes in vascular flow and caliber. Suppose this is a tissue and this is the venule, and this is the arteriole, and this is the arteriole. Blood flows like this, and this is the capillary bed. This is the tissue. Dear audience, you know, arteriole can dilate and it can constrict, but venule cannot dilate or cannot constrict, you know. The changes in vascular flow and caliber. What is the first change in vascular flow and caliber at the site of acute inflammation? The first change is transient vasoconstriction. What it means? There is transient arteriolar constriction. At the site of acute inflammation, there is constriction of the arteriole like this. Arteriolar constriction. When there is arteriolar constriction, dear audience, blood flow in the tissue will be diminished. We can cite an example. This transient vasoconstriction. A surgeon, when operate, give incision in the skin. You see, at the time of incision, there is no bleeding. After a few seconds, there is bleeding. Because for few seconds, there was transient arteriolar constriction. So there is no immediately bleeding. Later on, there is bleeding. And this transient vasoconstriction persists for few seconds. What is the cause? Or it is carried out by nerve reflex. The second change is arteriolar dilatation. What it means? The arteriole become dilated here. Second change. Arteriole become dilated like this. If arteriole is dilated, there is increased blood flow in the tissue. So arterial dilatation, then increased blood flow in tissue. When there is increased blood flow in the tissue become red and tissue become warm. So increased blood flow of tissue. Dear audience, again we can recapitulate. Arteriole dilates, increased flow of blood, but venule is not dilated. So increased flow of blood, at the same time there is opening of all capillaries. So increased flow of blood in tissue with opening of all capillaries. What it means? Dear audience, you know, in our both lungs, all the alveoli at the same time all are not open. Some alveoli in our lung remain collapsed. During deep inspiration, the collapsed alveoli accommodate the air. Like this, in our tissue, there are so many capillaries. All capillaries are not open. Some capillaries remain collapsed like the lung alveoli. During increased flow of blood, the collapsed capillaries opens and accommodates the blood. Dear audience, now increased blood within the tissue, but draining of blood is not increased because the venule is not dilated. As venule is not dilated, but there is increased flow of blood within the capillaries, so there is stasis of blood in the capillary. Then stasis of blood in the capillary. Blood in capillary bed. Why stasis of blood? Because there is increased flow of blood in the capillary, but venule is not dilated, so there is stasis of blood in the capillary bed. Dear audience, due to stasis of blood in capillary bed, there is another thing. This is called margination. Margination. What is margination? Margination means peripheral. It means peripheral orientation. It means peripheral orientation of leukocytes on endothelium of capillary is called margination. Peripheral orientation of leukocytes on endothelium of capillary is called margination. Dear audience, we know from physiology, if this is a blood vessel, we know at the central part of blood vessel lumen there is form element, that is WBC, RBC, etc. And the peripheral portion of blood vessel there is plasma like this plasma. If we see cross section of blood vessel like this, so this is the form elements at the central part. At the periphery there is plasma, and this is called lamellar blood flow or axial blood flow. In the central part the lamella is form elements, and around the central part at the periphery the lamella is made by the plasma. This is called lamellar blood flow, or it is called axial blood flow. As there is capillary bed, there is stasis of blood. During stasis, if there is like this blood flow like this, if there is obstacle here, there will be loss of axial blood flow. And if there is loss of axial blood flow or loss of lamellar blood flow, then the form elements will go at the periphery and they will line up upon the endothelium. The form elements will go to the periphery like this here and on the endothelium. This is called peripheral orientation of leukocytes on endothelium of capillary. It is due to loss of axial blood flow or loss of lamellar blood flow. What is the cause of margination? Cause of margination? Loss of axial or lamellar blood flow due to stasis of blood. So this is the changes in vascular flow and caliber in acute inflammation is associated with the 5 cardinal signs. Dear audience, today up to this, thanks all.